This is Stage 4 Thriver, where science meets soul, data meets wisdom, and healing happens on your terms. Here we build bridges between conventional treatment and alternative therapies to cut through the noise, find out what really works, and walk boldly towards a future that is cancer-free. I'm your host, Nicole Saunders, Stage 4 Cancer Thriver, integrative health coach, researcher, and mama. Just a quick reminder, everything shared on this podcast is for educational purposes only. Any new supplements, dietary changes, or healing practices should always be discussed with a trusted medical professional who understands your specific situation. My role here is to empower, not replace. Now let's jump in. If you're listening to this episode, there's a pretty good chance that you or somebody you love has recently heard the words that change everything. You have cancer. Those words can land in your body before your mind can even catch up. Your nervous system goes into overdrive. The room gets smaller. Time feels like it's moving in slow motion and warp speed all at once. I totally get it because I've been there. As a matter of fact, I found out that I had stage 4 cancer when I was driving home from the beach with my kids in the back seat. I found out in a phone call, and I somehow had to keep my eyes on the road and my hands on the wheel while trying not to have an out of body experience. So I totally get it. Here's the thing that I want you to know right now. Right now, you should pause, breathe, and just take a minute to absorb the information that you've just been given. Actually, take like 3 days. You just had an atom bomb drop into the landscape of your life. And as urgent as everything seems right now, this disease did not appear yesterday. It's not going anywhere in the next 72 hours. And so you do have some time. And with that time, you should just take a minute, take a breath, and pause. Today, we're going to talk about the first 30 days after diagnosis, what actually matters, what can wait, and how to stabilize your nervous system and your information intake so you can make clear and empowered decisions from a place of clarity and not panic. So, our first line of the day is to stabilize before you strategize. Let's start by naming something that almost no one talks about: the shock response when you hear a cancer diagnosis. Your nervous system doesn't just register information, it registers threat. Your body releases a flood of hormones: cortisol, adrenaline, norepinephrine. This is your sympathetic nervous system kicking up into high gear. And that's why in those first few days, you might feel numb or disconnected, hyper focused on tiny details while missing the big picture, unable to retain what your doctor just said, frozen or manic or both. This is your nervous system doing exactly what it's designed to do when it perceives existential threat. And that means you are not in the best state to make any major irreversible decisions right now. Not yet. Your nervous system is doing its job. Let it settle before you make any big moves. So, what actually matters in week 1? If you're not supposed to make all of the decisions right away, what should you focus on? Here are the core priorities for the first 7 days. Number 1, get clarity on your actual diagnosis. I know this may sound obvious, but you'd be shocked to hear how many people start researching treatment protocols and alternative therapies before they fully understand, what type of cancer they have, where it originated from, and possibly where it's spread. So there's some things that you really need to know in the beginning. You need to know the primary site, which is where the cancer started, the cancer type and its subtype, the possible metastatic sites, biomarkers, receptor status, and molecular testing results if they're available. Why does this matter? Because a breast cancer diagnosis with HER2 positive receptors, for example, is treated completely differently than a triple negative breast cancer diagnosis. A BRAF mutated melanoma has targeted therapies that a BRAF wild type melanoma doesn't. Every diagnosis is different, and therefore every protocol should be personalized. Number 2, request your pathology report and imaging. You have a legal right to copies of all of your medical records. You should absolutely request your pathology report, your biopsy results, imaging reports, whether it's a CT scan or a PET scan or an MRI. actual imaging files on a CD or digital portal if possible. These documents will be essential if you decide to get a second opinion, consult with an integrative oncologist, or work with a naturopathic doctor or functional medicine doctor. Number three, stabilize your nervous system. I'm going to say something that might sound a little counterintuitive, but your most important job in the first week is not to research every possible treatment. It is to stabilize your body and your mind so you can think clearly. Here are some practical ways to go about this. Focus on your rest and your sleep support. You can try magnesium glycinate before bed, melatonin, or calming herbal teas like chamomile or passion flower. Make sure your sleeping environment is dark and cool. Nourish your body. You're going to want to focus on whole foods that stabilize your blood sugar, which is most usually a combination of protein, healthy fats, and vegetables. Avoid inflammatory foods like processed sugar and refined carbs, and try to incorporate some gentle movement into your lifestyle. Even just a 10-minute walk or gentle stretching or restorative yoga. Movement signals safety to your nervous system. And then, of course, you could always try one of my favorites, which is breath work. You could try box breathing, for example, which is breathing in for a count of four, holding for a count of four, exhaling for a count of four, and holding again for a count of four. Repeat that cycle for 5 minutes. You could also try grounding, which is essentially going outside and putting your feet on the earth, in the grass. This practice literally grounds your electrical system and reduces inflammation in the body. Practices like these and others are going to be necessities in the coming days and weeks and even months. Your body can't heal in a constant state of panic, so it's going to be really important for you to find different ways to keep yourself calm and feeling a state of peace. Number four, accepting help and building your support system. I'm sure you are a fiercely independent person, but hear me out. Right now, you need to accept help from others. Community is medicine. It's one of the things that will help you get through this. And that could look like a lot of different ways for you. It might look like meal trains, it could be accepting help with housework or childcare, financial support through GoFundMe or community fundraising, rides to appointments or people going with you to take notes at the doctor, or just to give you moral support whenever your brain is feeling a little foggy. If community based support isn't available to you, reach out to your hospital social worker. They can connect you with nonprofit organizations, foundations, and resources that maybe you don't realize exist. Some of them may even include access to integrative therapies like massage or acupuncture. Don't fight this. Let people show up for you. Oftentimes, it's a benefit to them as well. People love to help. Let them. Number five, shifting your mindset. So, I'm going to get a little personal here for a minute and tell you about something that changed the trajectory of my own journey. So, I fought cancer actively for 2 years. And during that time, I had two recurrences, despite doing a lot of things to overcome it. But then one day after my second recurrence, something shifted. I made a decision deep down within myself that I truly, sincerely, genuinely wanted to survive. It was more than just hoping or wishing, it was something much more decisive. I decided that I was going to get out of this one way or another. I put my focus on my recovery and I wouldn't let anything else come into my mind. I wasn't just optimistic, I was laser focused. It was as if every other option other than victory just was completely off the table. I wasn't sure how I was going to climb the mountain in front of me, only that I knew I would climb it, period. One step at a time, one day at a time. After this mental shift, it seemed like everything else shifted too. My integrative practices, it just felt like they became more effective. And it wasn't long after that that I received my first clear scan. Now, I don't believe that mindset alone heals cancer. I think that it's a combination of things, but I do believe that determination is medicinal, and the research backs that up. A positive outlook is associated with lower risk of poor health outcomes, stress reduction, improved immune function, and better coping mechanisms. So your mindset matters. And if you're going to heal, it's partially because you've made the choice that it's worth it to you and that you're willing to fight for it. Now, let's talk about what not to do. These are mistakes I see over and over, and I've made some of them myself. So, mistake number one is information overload. Let me set the scene for you. It's 2 a.m., you can't sleep, and you're up Googling cancer survival rates. You're joining every Facebook group you can get your hands on. You're reading conflicting studies. You're considering booking a plane ticket to Mexico to go to a special clinic, and you are completely overwhelmed. Stop. I know that the urge to research is overwhelming, but here's what happens. You overload your already stressed out nervous system with fragmented, often contradictory information. You can't discern quality sources from fear based noise, and you start making decisions based on panic and not clarity. Now, I'm not saying don't join Facebook groups. I have learned a ton from alternative cancer groups and survivor communities, but this is really important. You need to use them alongside your own research, not instead of it. You're going to see testimonials. You're going to hear survivor stories. You're going to learn things that your oncologist never mentioned. And all of that's valuable and all of it's valid. But you'll also see people recommending protocols that aren't backed by research, a lot of people selling things or sharing advice that might not even apply to your specific cancer type. So here's the strategy. And this is something I really hope you can promise to yourself. Focus on understanding your specific diagnosis first. Join one or two quality groups, but cross reference everything you come across with actual scientific research before you act on it. Okay. So for number two, I'm actually going to keep expanding on what I just said because it really is of the utmost importance to emphasize. Mistake number two is rushing into protocols without understanding your diagnosis. I know I just said a little bit about that, but really, this is the big one. I've seen people start taking 15 different supplements, radically change their diet, book appointments with multiple alternative practitioners all before they've even received their full pathology report or understand their biomarker status. Here's why this is a problem. Without knowing your specific cancer type, receptor status, and molecular profile, you're essentially throwing darts in the dark. Some supplements may not even apply to what you're dealing with. If you do decide to do conventional therapy, there are things that can interfere with that, as well as things that can boost the efficacy. I mean, it goes both ways. But there are protocols out there that are based on outdated or irrelevant research, and some of them are just not appropriate for your specific situation. So let's shout it from the rooftops that every diagnosis is different and every protocol should be personalized. So wait until you have clarity on that diagnosis, then build your integrative protocol strategically and ideally with the guidance of somebody who's trained in integrative oncology. Mistake number three, starting too many things at once. Even when you do have clarity on your diagnosis, resist the urge to start everything at once. If you start taking on a ton of new supplements, changing your entire diet, or beginning a completely new regimen or routine, you're not really going to understand what's helping or what's hurting, what's potentially causing new symptoms, or what's making you feel really good. It's better to start with just one or two foundational things at a time, give your body a week to adjust, and then layer on the next intervention. Mistake number four, not getting a second opinion if you feel called to getting one. You don't have to accept the first treatment plan that you're given. Getting a second opinion, ideally from a cancer center that specializes in your specific cancer type, can give you the confidence in your path forward and ensure that you have all the options on the table. Sometimes the second opinion might just mean switching up the care team. I definitely know what it's like to not resonate with your doctor. My first doctor was all doom and gloom. She basically told me that I wasn't going to make it. I'll never forget the end of my first conversation with my doctor. We were about to get off the phone. This is right after I learned that I had stage 4 cancer. And I asked her if there was anything that she could leave me with that would be hopeful or optimistic, just something encouraging, just to leave on a positive note. And she said to me, "I'm not going to sugarcoat this, Nicole. This is going to be very, very difficult to treat." Just wasn't the vibe I was going for. So, if you feel like you're not on the same level as your doctor, or there's just something about the situation it's not sitting right with you, that is a voice that you should listen to. Uh, don't be afraid to get a second opinion. Don't be afraid to switch your care team. Remember, you are putting your life into the hands of this team, and it's really important that you trust them, and it's really important that you resonate with them. Today, I'm lucky enough to say that my doctor is actually one of my biggest supporters and biggest cheerleaders. Even when, the chips were totally stacked against me, she only ever offered me solutions to move forward and optimism and hope in my story. You deserve that too. Number 5, the pressure to be perfect. Remember that mindset shift I just talked about a little bit ago? You know, the decision to fight, to focus, to choose victory. Well, that's real and it matters. But here's what I need you to understand: that does not mean that you have to be perfect all the time. And it doesn't mean that you have to have a positive attitude 24/7. There will absolutely be hard days, days where you want to cry, days when you want to scream, days when you want to take a break from being brave. And that's okay. Let me say that again. That's okay. You are allowed to have those days. That mindset shift that I was talking about, it's not about toxic positivity or pretending that everything is fine, because it's not. But it is about having an underlying drive and a decision to keep going even when it's hard. So give yourself permission to feel what you feel, ask for help, say no to visitors if you have to, take a day off from the protocol, rest when you need rest. You are not failing. If you're struggling, you're human, and your healing journey has room for both determination and vulnerability. Whew, all right. So you've stabilized, you have clarity on your diagnosis, you've requested your records. Hopefully, you're sleeping. Now what? Now you can start building a safe, evidence based, integrative foundation. Here are 3 foundational steps you can take within the first 30 days. Number 1, you can start a baseline supplement protocol. There are a few supplements that are generally safe and well tolerated for most people with cancer. Of course, I have to give the disclaimer again that anything that you do in your own protocols and your own regimen, you should run by a trusted medical professional. But just for educational purposes, here are some of the top supplements for most people with cancer. Vitamin D. You can get your levels tested, but most cancer patients are found to be deficient in vitamin D. Optimal levels of vitamin D support immune function and increase survival. Omega 3 fatty acids. You can look for high quality fish oil or algae based EPA, DHA. Krill oil is another good example. These reduce inflammation and support cellular health. Magnesium. Most people are actually deficient in this. And if you're getting conventional treatment, chemotherapy is notorious for robbing your system of magnesium. So, magnesium glycinate is a good choice and it's well absorbed. It supports sleep, stress response, and literally hundreds of cellular processes. Melatonin is one that is actually not just for sleep. Research shows more and more that melatonin has anti cancer properties and can support treatment efficacy. Number 2, focusing on an anti inflammatory diet. So, the perfect diet for cancer is something that is widely discussed and debated, but before you can find that perfect, absolute, number 1 scenario for you, you can start shifting towards foods that reduce inflammation and support your immune system. This is pretty universal for all anti cancer diets. You're going to want to have a lot of colorful vegetables because they have phytonutrients that matter. High quality protein, your body needs that for repair and rebuilding. Healthy fats, which include olive oil, avocado, nuts, and seeds, and minimally processed sugar and refined carbs. Don't worry, we are absolutely going to do a deep dive on nutrition in a future episode. But for now, just know start where you are. In a nutshell, I would say that the Mediterranean diet is the way to go. It checks all the boxes, but more on that later. Number 3, establishing some integrative practices. These are, your mind body practices that, it looks like meditation, breath work, journaling, guided imagery, gentle movement. The list goes on. Pick a few that feel accessible. The research on mind body practices and cancer outcomes is actually quite compelling. Studies show that practices like meditation can reduce inflammation, improve immune function, and help regulate stress hormones. You don't have to do it perfectly, you just need to be able to start. So, in closing, here's what I would love for you to take away from this episode. The first 30 days are not about having all of the answers. They're about stabilizing, clarifying, and building a foundation. Get clear on your diagnosis, request your records, stabilize your nervous system, avoid information overload, don't rush into protocols before you understand what you're dealing with, and most importantly, give yourself permission to take this one day at a time. You don't have to have it all figured out right away. I hope to see you in the next episode, but until then, just know that you're doing better than you think. If you're looking for personalized support on your healing journey, I offer one-on-one integrative health coaching where we design a protocol specific to your diagnosis, your goals, and your unique situation. I also have diagnosis-specific integrative protocols available at www.stage4thriver.com. These are research-backed, evidence-based resources that take the guesswork out of building your integrative foundation. If this episode was helpful, make sure to hit that follow button so you don't miss the next one. I'll see you in our next episode, and until then, you're doing better than you think. Keep thriving.